all, this is NP student Emily, and today we're going to talk all things mono. Infectious mononucleosis is a condition that's caused by the Epstein-Barr virus. It generally affects teens and young adults, which is the reason it's important for you to know about it. Mono is spread by bodily fluids like saliva, hence the kissing disease. It does start to give you symptoms about 4 to 6 weeks after you've actually been infected by it. These symptoms do include fever, headache, body aches, sore throats, rash, swollen lymph nodes in the neck and armpits, and a swollen liver or spleen, or even both. One of the big concerns with mono is the spleen enlargement or the swollen spleen. Your spleen is in charge of removing old and harmful products from your system, like old and abnormal blood cells, as well as handing out good cells throughout the rest of your body. The spleen is also in charge of making blood cells, other than where they're made in the bone marrow. So whether your spleen is larger than it should be can be a great concern, as it can cause symptoms like abdominal pain to the left upper side and left shoulder pain. There are tests that can be done to look for an enlarged spleen, and these can include blood tests, physical assessments, or diagnostic tests. So blood tests can include a CBC, and this will look for low hematocrit levels and high white blood cell levels. Your physical assessment is going to include palpation and percussion, just to see if you can hear or feel a spleen that's larger than it's supposed to be. And finally, an ultrasound of the abdomen can see the spleen and measure it. So this will give you an actual picture of what the spleen looks like inside your body. Now, when a spleen is larger than it should be, there's a chance that it can rupture or split open, which is dangerous. When it does rupture or split open, it can lead to a huge amount of blood loss, which could eventually send you into hypovolemic shock as well. Now, with this, more often than not, these types of injuries or ruptures will occur between 21 to 31 days after the start of your symptoms. That's why it's important to restrain from physical activity during this time frame. If a large or swollen spleen is a concern for you while you have mono, you will really need a follow-up appointment after about the 31-day mark, just to make sure that it's safe to return to physical activity. The best way to treat your symptoms with mono include just plenty of rest and a lot of fluids. Just push everything out of your system. You're also going to want to use Tylenol and ibuprofen, and this will help treat both the fevers and the body aches. Now, again, if a swollen spleen is something that does happen while you are dealing with your mono, there is the option to remove it. Now, the old way of surgery isn't really used anymore. These days, they pretty much stick to laparoscopic surgery, so they make 4 small cuts. In one cut in the abdomen, they put in a camera so they can see what they're doing, and then in the other 3 cuts, they use tools to be able to remove the spleen. Honestly, with this type of surgery, patients are usually in and out same day without not too long of a recovery period. And overall, with mono, patients usually recover without many problems within a few weeks. There are some symptoms like the fatigue that can last longer, over a couple of months, eventually will go away. It is important to note, however, that while you have mono, if you begin to feel like you're having difficulty breathing or shortness of breath while lying down, please seek emergency help immediately. Have a great day.